I remember Julia telling me that of all the different therapies that have been researched on the complementary side, that exercise was the single one for which there was the most evidence. Does that resonate for you?
Sure. Yeah. So I'm a big believer in the American Institute for Cancer Research, World Cancer Research Fund recommendations for reducing the risk of cancer. Number 10 says for cancer survivors, follow the 9 guidelines above. And number 1 is to be a healthy weight. Mm-hmm. We now believe that 40% of all cancer in the United States is related to overweight or obesity. And the second one is to be, currently it says move more, sit less, which I think is less prescriptive than the 2007 guideline, which said be physically active for 30 minutes each day. And I think the evidence is really quite clear that physical activity decreases the risk of breast, colon, and prostate cancer, and that patients with a number of cancers, including those 3 plus also pancreatic cancer, who are physically active do much better with regards to survival than people who are not physically active. And we also know that patients would like to hear about physical activity or be told to be more physically active by their oncologists. And even though 50% of oncologists believe that that's a good thing to do, very few actually do it because they don't have time. They're treating the cancer and not the patient living with cancer. Mm-hmm. A recent study came out and showed that people who are sedentary, and people have become much more sedentary since the pandemic because they're in their house, who do not exercise for 150 minutes a week have a 5-fold greater risk of death than people who are physically active, who exercise 150 minutes a week, and who are not sedentary.
That's only 20 minutes a day.
Yeah, or 30 minutes 5 times a day, a week. Mm-hmm. Yeah, it's whatever. But that's 5-fold increased risk of death is pretty profound. Mm-hmm. So I think people need to get out and exercise and move. And that's absolutely correct. Mm-hmm. And I believe it should be aerobic. So something that gets your heart rate up and in fact makes you sweat, as well as resistance, because so many cancers like to go to bone. And I think resistance exercise not only keeps the muscles toned, but the bones mineralized. And then I discovered late in life the benefits of yoga, which is strength, flexibility, and balance. And those are all things that we need as we grow older. But in addition, I always say Jewish boys can't meditate. But at the end of a 60 or 90-minute yoga class, when we do Shavasana, the corpse pose, and they say, you can come back now, I feel like I've gone someplace. That's so wonderful. For me, yoga is a good mind-body intervention, as well as strength, flexibility, and balance.